And my name is Greg Owen, and I am co-founder of iwanttoprepnow.co.uk. I personally, as a gay man having sex and having come out of a long-term relationship, was aware that my risk of HIV acquisition had increased over a certain period of time. And I had seen PrEP mentioned online, mainly on Facebook from the States, because they had it approved there since June 2012. But I didn't really believe it, and I couldn't find any information that was UK or Europe based, apart from study data, which is like a little bit intense. So I managed to get some PrEP from a HIV positive person, so Truvada. I managed to get some from a person who no longer needed those meds because they changed, and I was too late. I got a HIV test and it was positive. So it was kind of a little bit ironic. So I went and I did some research with our co-founder, Alex Craddock, and we were aware, but we really went and confirmed that we could definitely do what the website does, which is signpost where to buy genuine generic Truvada PrEP online for an affordable price. So it was really born out of reaction to my own personal circumstance and out of pure frustration, anger, and bewilderment that this thing existed, and no one was talking about it. It was insane. In regards to did I do market research and did I know there would be a demand, our co-founder Alex Craddock had actually managed to get some free PrEP in New York while he was traveling there. So he was on PrEP, but he was running out. So I certainly didn't expect the reaction and the speed at which the UK embraced the concept of PrEP, and furthermore, the new concept of self-sourcing. So we started off, I think, in our first month, we had 400 unique visitors, and now we're currently averaging 20,000 unique visitors per month.
Wow.
It's increased exponentially, and that's now from what was a little local London gay and bisexual men's project. It was a throwaway project, has turned into a global initiative. So it's kind of quite overwhelming, but I'm very proud. We have done a couple of surveys. Our sister site that we work very much hand in glove with is a site called prepster.info, co-founded by Mark Thompson and Dr. Will Nutland, among others. And we have run a couple of surveys that have been supported by Public Health England to try and ascertain how many people are using PrEP, how long they've been using PrEP for, and how they use it. And correlating that with dynamic sales data, we're able to extrapolate that we think somewhere in the region of about 8,000 people before the trial started, the impact trial started. We think about 8,000 to 10,000 people were currently self-sourcing generic PrEP online in England and the UK.
Wow, that's a lot. Yeah,
I know, right? First of all, on a biomedical level and an epidemiological level, it's stopping people contracting HIV. So in central London clinics, where we know they have a big cohort of men who have sex with men, and a big cohort of those people are on PrEP, self-source PrEP, we've seen significant, dramatic, I'd even say, reductions in HIV diagnoses within those groups of people. So we know it works, and we know people are using it. So on that kind of official line, it's working, and we're starting to see results already in combination with treatment as prevention and regular testing, and condoms for those who choose to use them. But what I'm starting to see, which is really interesting for me, and some of the byproducts of people using PrEP are wide-reaching. So first of all, we're starting to see gay men, I'm talking about predominantly because they've been the early adopters, we're starting to see those people start to approach their sex and the kind of sex they're having and the people they're having that sex with and the way they're having that sex in ways outside of the bracket of risk, infection, death, and illness. So we're now starting to see a change in the flavor and the tones that gay men are approaching their sex life with. And I think is long overdue. Our sex is not a science experiment. It's not something that exists in a petri dish in a lab. And it's really hard for me, as someone who belongs to the HIV prevention sector and who spans the medical sector as well, it's really hard to try and balance what I know sex and love and enjoyment and pleasure is with what I know we have to do for risk reduction and HIV prevention. So it's nice that the narrative is starting to change because people have the freedom to do that. Also, I think the zero divide, the divide between statuses, is starting to drop. So as a person living with HIV who kickstarted this website and who kickstarted one of the people who kickstarted the PrEP movement in the UK, it's now very lovely to see the people who I helped and supported and facilitated access to PrEP advocate for undetectable equals untransmittable, and to see that shared responsibility, because we're all kind of on the same page. And it's just really refreshing and inspiring and motivating to see gay men drop all of the things that we just, it's natural to feel those things. And it's, it was in response to trauma and a lot of pain and illness. It's nice with treatment as prevention and PrEP to start to see that shared responsibility now. Predominantly gay and bisexual men who have sex with men, have made such a song and dance about PrEP over the last 2 years in the UK. There's certainly awareness of it on a top line level is floating around more so than it had been. And we are starting to see people from those other communities and key populations pick up the baton that gay men have led with and really start to try and integrate PrEP and actions within those communities. Ultimately, for me, I think it's part of the problem if a cis, white, HIV positive gay man starts trying to jump all over PrEP and HIV prevention for other communities that I don't represent. So our work is to find key navigators and movers and shakers and community leaders and community activists and advocates from within those communities and support and elevate them. That's our job. And it can only happen like that. And it's starting to happen, which I'm really excited about.